Hello guys, welcome back to the channel. It's Unit 12 Part C. Let's see about the methods of family planning. In that first we will deal with the temporary method. In temporary method the first one is natural method. In natural method we have abstinence. That is nothing but not having sex. Any kind of sex is restricted. They should stop it, like not having vaginal sex, anal sex or oral sex. If they are not having sex, then automatically the pregnancy will be prevented. And then second is withdrawal method. This is the couple can have intercourse without any kind of protection, but at the time of ejection of the sperm, the couple should withdraw the penis from the vagina. The main thing is to prevent the semen entering the woman's body. If it's not entering, then automatically pregnant can be withdrawn. And then we have a lactation amenorrhea method. This method is followed after the birth. That is, after giving birth, for next 6 to 9 months, the woman's body will produce more prolactin. That is, she'll be breastfeeding. At that time, prolactin will be produced. When there is lot of prolactin, the ovulation will be suppressed. When there is no ovulation, when there is no egg release, at that period, the couple can have sexual contact and the pregnancy condition will not occur. Only in 1 or 2 percentage the pregnancy condition has been occurred. Second method, the biological method. And in this biological method we have three types: calendar method, temperature method and a mucus cervix change method. In biological method, the first method is calendar method. In calendar method, it is a calculation method. For 6 months you need to see at what date you are getting your menstruation. Like in this month you got on 28th your menstruation. In next month, in what date you are getting, like on 26 or 25. You need to keep on marking for 6 months. When you keep on marking for 6 months, after 6 months you'll get to know how to calculate. On calculating you can find which is ovulation date and when you can have sex and you can't get pregnant. Like on calculation you need to take the shortest interval and the longest interval. From the shortest interval you need to minus 18. From the longest interval you need to minus 11. And the period between this both shortest and longest period is known as ovulation. Let me explain you in detail. Like in last month the woman got menstruation and after 28 days she got her next month menstruation. So that is the shortest interval. It's not same for her. She has been calculated, and if she see, she has got one time on 29th day, one time on 30 day, one time on 32nd day she got. On that, if she see, the 28th day is the shortest interval. She took that 28th day, and the longest interval is 30 days. In shortest interval she minused 18, she got 10 days. In longest interval she minused 11, she got 19 days. And 10 to 19 days is the ovulation period. On that period she can't have sex. She can have before this, after this. That is, the first safe period is 1 to 9 days. The second safe period is 20 to 30 days. This is calendar method. Next we have temperature method. Temperature method is soon after waking up you need to check your temperature. You should not get out of your bed. That condition itself you need to check your temperature, body temperature. At the time of ovulation or when the ovulation is nearing, automatically your body temperature will increase in the early in the morning. By that you can find on which day you should not have sex. Next, mucus cervix change method. This method, generally there will be a white discharge or a jelly like discharge which indicates the ovulation period. If the discharge is very light, watery, then in next few days, in 2 or 3 days, ovulation will occur. If the discharge is thick, like thread like or like a cloth like structure, then the ovulation is going on. You should not have sex. These are the biological method. Third method, chemical methods. And before starting, in chemical method we have injection, tablets, gel, cream, films and all. Whereas if you see in hormonal method also we will have tablets, injections based on estrogen and progesterone methods. Then why still the chemical method and hormonal method is kept different? It's because in chemical method you will not intake the tablet, you will not take the tablet in the mouth. Whereas hormonal tablet, you will take the tablets in the oral way. And chemical methods is only applicable when you will have the sex. Before having sex, the chemical method should be followed. Whereas hormonal method, it should be taken daily, whether you are having sex or not, no problem, but to regulate the hormones you should have it daily, not daily, at least weekly purpose. There are different types of methods, one is daily and other is weekly, whether having sex or not. But this method, in hormonal method, it should be taken compulsory, whereas in chemical method it's not compulsory. In chemical method, the first method is foam method. Here we will introduce the chemical into the vaginal wall of the female in the form of injection. For this we do have an example, that is delphin. And then vaginal tablets, here the tablet will be inserted into the vaginal walls, and then this tablet will make the environment acidic in nature, so that the sperm which enters the environment will die and the pregnancy will not occur. We do have double check and orthophonic, or the brands of vaginal tablets. And then we have gels and jelly creams. This is applied on the superficial layer around the vagina, it will be applied. And we have example for jelly, gel and cream. Next we have films. These films are like, paper like structure. It should be applied on the tip of the penis, and after applying, the couple can have intercourse and they will not get pregnant. The advantage of this method is you can purchase it from pharmacy and there is no need of doctor's prescription is needed at this condition. Whereas disadvantage is it has side effects, allergies, and it will not protect you from HIV and sexually transmitted disease. And next we have the fourth method, that is the mechanical method. And in this mechanical method we have condoms, female condoms, diaphragm, femcap and IUDs. First, condom. Condoms are like a sheet like structure which is made up of latex, and it covers around the men's penis. And the main function of this condom is to collect the semen and prevent the sperm to get inside the vaginal area. And the other names of these condoms are rubbers, sheets, skins. And this is available in different size, shape, color, flavor and all. While female condoms, this is made up of thin polyurethane sheets, and it has two rings on the each end. It will be like a sag or pouch like structure, and its main function is also the same, to not let the sperm to let inside the vaginal wall. And even after using this female condoms, there are few chances that women might get pregnant. Now what are the advantages of the condom? It is safe to use, there is no any hormonal side effects, and it prevents us from the sexually transmitted disease, and it is available in all the pharmacies and there is no need of a doctor's prescription. And next, if you see, it is even available in the family planning clinics and other health centers also, and it will not cause chronic pains. That conditions will be reduced if the couples use condoms. And there is no need of doctor's advice for using the condoms. It will not affect the breastfeeding conditions, and all age men groups can use these condoms. And next, what are the disadvantages? In disadvantages, the enjoy of the sex will be very less, and couples feel embarrassing to purchase it in the public places, while few men are very allergic to latex, then that might cause itching in the area, and it takes a time to wear and remove the condom, and in some cases even partner feel embarrassing to ask to use the condoms. These are the disadvantages. Next, diaphragm, and it is a spermicide which is actually covered with silicone or latex layer, and this is actually inserted into the vagina same like the female condom, and it blocks the entry of sperm. While it can be used before having sex, before 6 hours it can be used, and for next 24 hours it can be kept, and there is no side effects for that. And even after using, there is a 16% chance that women might get pregnant. While next is femcap. Femcap is like a hat like structure which is made up of silicone rubbers like this it will be, and it is covered with spermicide. and it will be placed inside the vagina that blocks the cervix, which blocks the entry of the sperm. And next we have IUDs, and IUDs is nothing but intrauterine device, which is like a T-shaped plastic device. And first it was discovered by Grumfenbrink. He discovered it with the help of silkworm guts, and then later it was converted to silver ring, and now we are using it in the copper wires. This IUDs has two types: non-medicated, medicated. The non-medicated IUDs are first generation IUDs, which is just made up of plastics, and they are available in different shapes and size like Lippies loop, springs, coins and rings. Medicated. In non-medicated we found the first generation IUDs. In medicated we have second and third generation IUDs. In medicated, with the copper wire, we have hormones like progesterone present in it. In non-medicated, there is no any hormone present in it. In this generation of IUDs, we have copper T380A, copper T200B, multi-load, that is ml, multi-load copper 250 and 375, Nova T. These are the IUDs. Let me explain what is this. Like copper T, that is T-shaped frame which is made up of polyethyl. T-shaped frame which is made up of polyethyl, and the copper which is present, which is covering this layer, is 380 mm square. That is copper T380A. What is copper T200B? That is the T frame polyethyl which is covered with the copper of 200 mm square. Like that only 250 and 375. These are the IUDs, and let's see what are the advantage of it. Advantage is it will not affect any breastfeeding mothers. Even though the copper T is covered with progesterone, it will not affect the breastfeeding mothers, and it will not disturb during the intercourse. There is no any side effects of hormones, and a woman above the age of 20 can use. There is no age restriction above that, and there is no problem for in the time of reproductive years. It is safe to use at that time also. And at the time of fertility, that is when the couple has decided we need to have a baby, at that time that will be removed. Since it is a temporary method, it can be removed and normal fertilization will be occurred. And next we have disadvantages, like it will not protect us from a sexually transmitted disease, and there might be an infection occurring because of this. They have some kind of side effects, but not really a severe kind of side effects. And these are the sexually transmitted diseases examples. These are the disadvantages of IUDs. Contraindications of IUDs: if they have any kind of sexually transmitted diseases or infections like AIDS, gonorrhea, chlamydia and PIDs, and any kind of infections or diseases like Wilson disease and leukemia, then they are not advised to use it. If the woman is allergic to copper or she is pregnant, she is not allowed to use it. And if she has a history of past history, that ectopic pregnancy, that is the pregnancy, the fertilization has been occurred in the fallopian tube or any other region apart from uterus, at that condition, the abnormal pregnancy, that condition, she is not allowed to use it. And if there is any kind of abnormal vaginal bleeding also, she is not allowed to use it. These are the contraindication. Next, the side effects. Side effects of this is, while after using this, the woman has been experienced that the bleeding of during the menstruation is very long. There is prolonged bleeding, amenorrhea is found, and the pain during the menstruation is severe. And the pain during the insertion, that is when this device is inserted, at that time generally the pain lasts for few seconds or minutes. This is normal, but in few women the pain has been lasted for hours and days. This is the side effects. The last method in the temporary method is hormonal method, and it has COC, POP. These both are tablets, contraceptive tablets. And then we have weekly once pill, and then morning after pills, and then in injection we have a monthly once injection, and then progesterone only injection. These are under the hormonal method. Hormonal method. In hormonal method, the first one is COC, combined oral contraceptive pills. These pills are made up of in the combination of estrogen and progesterone. In together, one pill is made. How it works? First, primarily it will inhibit the ovulation. It will stop the production of egg and the release of egg. And secondly, it will stop the entry of sperm inside the uterus. It will block the way. How it will block the way? It will thicken the cervix in the way of transporting vagina, cervix and uterus. This is how the sperm transport. If the cervix walls are getting thickened and the way will be blocked, that way the sperm can't reach the uterus. And apart from this, this tablet makes the uterus environment as a acidic in nature, so that even by chance if the sperm gets in, because of that acidic nature, the sperms will get died. And then there are two types of COC pills. One is Malayan and other is Maladi. These are popularly used COC pills. These are available in the community camps and family welfare centers and other centers. Apart from these two, we have now several other products which have been followed in the COC types. What are the side effects of these pills? First, it will increase the heart, blood pressure, nausea, vomiting, dizziness, and in some patients, not very rare patients, depression is seen and irregular bleeding is also seen. If you find any kind of side effects, you need to visit the doctor. And apart from this, mainly if you see any kind of this warning signs, you need to visit the doctor immediately. First is abdominal pain, chest pain, headache, eye problem and severe leg pain. If you see these symptoms, immediately do visit the clinic nearby you. And next, what are the contraindications for which patients you should not provide COC? Breast cancer, liver cirrhosis, any kind of tumor in the liver, and if the patient has any kind of heart disorder. POP, which is also known as progesterone only pills. By the name itself, you will get to know this tablet consists of only progesterone hormone and there is no estrogen hormone. And this pills is also known as mini pills. And how it works? It works same like the COC has been worked. Like first it will stop the ovulation, and second it will stop the transport of sperm inside the uterus by blocking the way and making the area acidic in nature. And this tablet is contraindicated for breastfeeding mother, and as well as COC is also contraindicated for breastfeeding mothers, because COC and POP, this both tablet consists of progesterone hormones and COC consists of progesterone and estrogen hormone. This both hormone, progesterone and estrogen hormone, if it is present in a woman's body, then these two hormones will actually suppresses the work or suppresses the production of prolactin hormone. For breastfeeding mother, prolactin is very important. Prolactin is the hormone which produces the milk. So if there is no prolactin, then there is no milk. So for breastfeeding mother, we will stop the tablets which has a content of estrogen and progesterone hormone in it. And next, once a week pill, this pill will be taken once in a week, like every Monday or every Tuesday, like that. And this tablet is also known as Saheli in general pharmacy or any kind of community stores. This tablet is available per 1.5 rupees per tablet. Morning after pill, that is, if a couple has committed an sexual activity, that is unprotected sexual activity, the next morning or within 24 hours or within 3 days, mainly not after 3 days, within 3 days, the women should take a tablet which consists of only progesterone in it. There is an example for this morning after tablet, that is after having an unprotected sex, the next morning or within 24 or generally within 3 days, the women should take a tablet. So this tablet will stop the conception. The example for this tablet is levonorgestrel. And next we have once in month injection. This injection should be taken every month. If you skip any month, on that month it will not work. Like on that month, if you commit any unprotected sex activity, then there is a chance the woman might get pregnant. This injection consists of progesterone and estrogen in it. This can be taken the woman one who is in the menstruation period, and after abortion, that is after 7 days after the abortion, the woman can take it. And the woman one who is breastfeeding, after 3 weeks of breastfeeding, she can actually take it. But in breastfeeding women, there is no need of taking this kind of injections, because breastfeeding, at the time of breastfeeding, the ovulation process will be stopped. the inhibition of ovulation will be done. There is no release of egg. So at that time, like for 6 to 9 months, the ovulation will be stopped. So at that period, if you have unprotected sex also, it's okay, the woman will not get pregnant. Next, progesterone only injection. This injection consists of only progesterone hormone in it, and one injection will work for 2 to 3 months. Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.